Yes.
So we did a DiscFX on you,
Mm-hmm.
and we did it, what, a couple weeks ago?
10 days ago.
Mm-hmm. Okay. And you're doing quite well afterwards?
Yes.
So you've had this problem going on for like 4 or 5 years?
Yes.
Right? And then did anything bring it on that you remember,
No.
or it just came on
No.
just sort of over time?
Yeah, there's never been a definitive answer as to how it all started.
Mhm.
No, not that I can recall.
And you had injections, where was it, in Kansas City? In Kansas City. You were
Yeah.
having injections, and
Yeah.
you were getting them every 3 to 6 months
No,
or
I
so?
had one that initially that was well over 10 years ago,
Mhm.
and it was, kind of like you had the first one,
Mhm.
do a second one, and maybe a third one. After
Mhm.
the second one, I was almost 100%. I said, "You're good,"
Mhm.
and it lasted till I moved here. It lasted 8 years.
Mhm.
Then, when it acted up again,
Mhm.
we did the epidurals, but it wouldn't last as
It
long.
wasn't as,
It
wasn't good.
wasn't as effective.
And the problem, back problems do tend to get worse over time, and
Yeah, I'm not
and
kidding.
so, yeah, exactly. So, but we had done some injections,
You did the nerve ablation. That really didn't do anything.
right, that was more for back pain.
That was more for
And
the
then
back, and then you did 2 of the
epidurals,
epidurals, and
and,
that lasted for a while. And I waited about almost a year to come back to you,
Mhm,
and
mhm.
it's back again.
And then we knew it was just gonna be.
It's gonna be a,
So we
let's
decided
try to
to
fix it.
try and do something more long lasting. So
Yes.
what we decided to do, we had a little disc protrusion at right at L4-5, and a little something at 5-1 as well. So what I was able to do is, with a very 1/4 inch incision, go through the side and just take a piece of the disc get into the disc, and with tiny graspers go in the disc and remove part of the disc and then vaporize part of the disc.
Mhm.
And I did 4-5, and I took a little bit out of 5-1 as well. And you had a lot of pain into your calf,
Right.
and that was really bothering you with walking.
Yeah, especially with a hill. If I'm on level surface, it just took longer to work
Mhm.
it to happen. But if
Okay.
it hills, it didn't take long at all.
So how much pain did you have after the procedure?
None.
Well, I mean, pretty
I
pain-free.
honestly,
Yeah.
I got home that night, like I told you, and I couldn't even tell you where you did it. I couldn't feel nothing. And you're reading your instructions. Oh, you might have pain and need ice, and you gave me the hydrocodone, and I went, I think
Well,
you're
not
fine.
everybody is as tough as you. But
No,
but I mean, usually there is some pain for the first
I was
for the first
surprised.
4
I was
or 5
surprised.
days. But you did exceptionally well. So
I was
so
very
pain
surprised.
was not an issue
Now,
afterwards.
like I said, I took a couple of ibuprofen a couple times in the last 10 days, but that's it.
Was the calf pain gone pretty immediately?
Well, I did for several days. I didn't even walk much except go
Okay,
back and forth to
okay,
the bathroom.
but then
but
the
I
calf
did,
pain got better.
I did walk.
Mhm.
I did take about a block up and block and the calf didn't bother me.
Okay, so the
The
calf pain
quad
is
still-
better, and that's a separate
Yeah,
problem.
that's a separate
which he
problem.
has here.
But the
So,
calf, right now,
That's great. No, I think it's gonna persist and continue. So, anyhow, so it was we were able to go in and really take a piece out of the disc that was pushing on the nerve root, and which is what was causing calf pain. And so now that the disc is not pressing against the nerve, you're doing much better. So I think you're gonna do quite well, and
I'm encouraged.
So glad. I'm so glad you've done well.
So am I. Thank you.
Okay, great. Thank you.
Thanks. Mhm.